afternoon, everyone. My name is Mrs. Justine Odwongo, CEO Mind, Body and Soul. Majority of you might have known me previously as Musawo Justine Nakimuli Odwongo, and there's a change in name. Here this afternoon to discuss Covert Racism. This has bothered me for some time. As an organization, Mind, Body and Soul is continuously receiving complaints from young people, from adults working in big government organizations in regards to covert racism. My biggest beef with covert racism is it is passive, it is placebo, it's difficult to report, and majority of the time we don't have evidence for it. But it's the biggest cause of mental illness in majority of people who have worked in government organizations. It's the biggest cause for people quitting their jobs because they would rather live quietly than trying to go head to head with an organization. Why am I here? Last week I was contacted by a young man who is due to go to university. He was out there working for an agency trying to earn some money to get into university. At the end of his shift, there was about 3 black young boys. At the end of his shift, they were both placed in a small room, 2 of them at first, joined by another one, and informed that £2,000 had gone missing. Okay. But they were not the only people on the shift. There was white colleagues on the shift. A few minutes after, they were then informed it was not £2,000, but it was stock worth £2,000. These boys were searched, body searched by the security guard. The 3 black boys. But what did this tell their colleagues who are white? Black people are thieves. These boys were racially profiled and told they had stolen money. They arrived home late. Nothing was found by them. And the organization, nothing was done to them. They got away with that, racially profiling them. Those of you who work in NHS, if you look at the lower bands, band 2 to 5, majority people of my color, they don't develop racially profiled. In fact, some of the job adverts are saying we are happy to recruit BAME people. When you look at from band 7 to 8C and above, there's not majority of my color are seated up there because it's almost racially profiled to make you feel that we are not competent enough. We are not intelligent enough to do those jobs. When we go back to maternal health, in maternal health, the statistics are showing that 6 out of 10, that's a big number, in the US, 6 out of 10 black women who go to have a baby in hospital could die during childbirth. In the UK, it's half of that. But why are we dying during childbirth? Because some physician in the 80s wrote a book to say that black people have a higher pain threshold compared to white people. Most so, majority of things that happen to our bodies when we are unwell cannot be identified any quicker than the white people. So when it comes to maternal health, we are not well understood. When it comes to mental health, we are not well understood. And instead of further research taking place, we are racially profiled. Those of you who live in certain areas, when there's some noise next door, the police is right there because you're a black family. Those of you who work in mental health units, when a black man kicks off, 10 people come to restrain him. When a white man kicks up, you shush him into his bedroom because there is this perception that black is aggressive. We need to work together on fighting racial profiling, covert racism. We need to start collecting evidence in regards to this. If you're asking for professional development for 5 years and you're not getting any of that, but your white colleagues in work are getting that, why don't you question yourself? Write it down. Go to your manager. Question it. I asked for this last year. I'm still asking. How come so and so has been able to achieve it and I haven't? I could speak about this for years and years. For many of you know, I have been in NHS for over 20 years. It's a brilliant place to work, but it also has its downfalls when it comes to racism, systemic racism. It has its downfalls. But if you want to talk more about systemic racism, covert racism, you want to share your stories, please go to our website, cphmindbodyandsoul.org.uk, and drop us an email on info@cphmindbodyandsoul.nhs.uk. We are here to collect that information. We are here to tackle these things. We want to support you. I cannot go through what my great-grandparents went through in the UK. I don't want my children to go through the same. Things are changing, but they're not changing quick enough. Thank you. Have a wonderful day. Musawo Justine Nakimuli Odwongo, CEO, Mind, Body and Soul. Thank you.